I'm Pat Wakefield, professor in health policy and management at the DeGroote School of Business, and I'm the instructor for HM706, Health Management Foundations 1. In this course, we explore and you will become familiar with strategic management and marketing principles, consumer behavior, and other theoretical perspectives and their application in the healthcare industry. The course is divided into 4 modules, each with readings and weekly discussion questions for which you will be divided into smaller groups to facilitate discussion. Each module has an assignment, the largest one being to create a marketing plan, and that's module 3. So you have some time to think about it, but you could also be framing some ideas in your mind right now. The best is if you can find a topic that's related to your work, and that would make it actually usable, and you'd be able to solve something at work. Your workmates would see some tangible evidence of the benefits of you being in the program, and maybe the plan would make your life a little bit easier. So be thinking about that. During the course, we look at a lot of different topics, but they all relate to strategic management and planning. We also look at human resource planning and management. We look at marketing within the healthcare industry. A lot of people think marketing, healthcare, that sounds bad. The word marketing is bad. It's got to be trying to sell us stuff that we don't want and don't need. That is not the definition of marketing, and I'll say that right now. Marketing is trying to figure out what it is that consumers want and need, and then designing a product to suit that. So it's in the spirit of that definition that our course is called Healthcare Marketing. We also look at management of communications and how best to communicate to your target market of people who are very concerned about healthcare. Healthcare is really different than other products that are marketed. We have like tangible products like cereal and clothing and prescription medicines where you can touch them and feel them and see them and package them, and they come standardized or sometimes not standardized. Maybe they're individually made, but they're tangible products. We also have services. Think about what services from a doctor. You go to see a doctor. A lot of the products within healthcare are intangible because they're services. That you can't store them, you can't package them and put them on a shelf and pull them out when they're needed. So we sometimes have real issues with scarcity of resources, especially when there's a crisis of some sort or some problem in some country outside of North America where they don't have all the facilities and all the people to draw on. So we look at those kinds of issues as well. Management of communications is a big one, sometimes getting bigger as we have crises that take place within healthcare. I mean, years back now, you can think of the SARS epidemic. When it hit, that was a crisis. So things had to be put in motion. So that's a quick overview of the kinds of things that we talk about and look at within the course. I look forward to working with you and to getting to know you better during the term.